We've been involved in REALISM, which was a study looking at current practice in treating patients with myelofibrosis. The principle was whether all centres in the UK apply guidelines as available, and how patients with myelofibrosis specifically were treated either according to guidelines, according to international prognosis scoring system criteria, or the BIP score, and whether the action to patients with myelofibrosis were promptly taken when there was a change, for example, in the grade of the myelofibrosis. So the study documented that overall there's a good application of the clinical guidelines. However, there are some delays in some patients' identification. For example, in treating with a JAK2 inhibitor such as ruxolitinib, and there's been a few centres where there was probably continuation of best supportive care for too long, rather than promptly switching to JAK2 inhibitors. This is quite interesting, and it does reflect perhaps the need for more support in terms of training and updating in some areas, such as myeloproliferative neoplasms. Many hematologists, I guess, across the country treat patients with myeloproliferative neoplasms, but perhaps not every hematologist are specifically either expert in the area or particularly interesting in the area, and that can potentially delay some of the actions that could have been taken a little bit sooner. Especially in hospitals such as DGH, so district general hospitals, where this area of expertise might not be present, and sometimes patients with MPN are treated by non-onco-hematologists, so where the knowledge are probably coming from a non-specialist subset. So that was probably one of the most interesting output of the study, which obviously lead to the next step, which probably is to try and increase the education package, and try to highlight how important it is for patients with myelofibrosis to be recognized at the appropriate time and be changed to the appropriate treatment, which has an impact in quality of life and potentially survival.